Hi, I'm Dr. Deborah Danilovic, and this study is about circulating microRNAs in the follow-up of papillary thyroid carcinoma patients. The present study was supported by FAPESP. Clinical follow-up of papillary thyroid carcinoma patients usually includes serum thyroglobulin dosage and neck ultrasonography. However, patients submitted to partial thyroidectomy or not treated with radiodyne may have persistent thyroglobulin despite no tumor recurrence. We also know that anti-TG may interfere in thyroglobulin dosage in immunometric assay. So, we consider that the detection of circulating microRNAs could be an alternative method in the follow-up of these patients. We know that microRNAs are small, stable cell type specific RNA molecules differently expressed in tumors compared to normal tissue. So the objective of the present study was to determine differently expressed circulating microRNAs in patients with metastatic PTC. RNA was extracted from plasma samples from 18 PTC patients. All of them had been submitted to total thyroidectomy and radiodyne therapy. 9 had metastatic PTC, 3 had only lymph node metastasis, 3 radiodyne responsive distant metastasis, and 3 radiodyne refractory distant metastasis. We also had 9 controls that were represented by PTC patients who had excellent response to therapy for more than 5 years. Circulating microRNA expression profile was determined by arrays containing 754 microRNAs, and expression values were normalized to mere 16. We performed a supervised hierarchical cluster analysis. First, we compared all metastatic PTC patients with controls. We identified 4 different expressing microRNAs. miR-17-5P was 6 times overexpressed in patients with any kind of metastatic disease compared to controls. Then we performed cluster analysis of subgroups. First, comparing distant metastases and controls. 3 microRNAs were differently expressed in this comparison. LET7C5P was 6 times more expressed in distant metastases compared to controls. Then, comparing lymph node metastases with controls, we identified 5 different expressed microRNAs, and should be highlighted that miR-146B5P was 10 times overexpressed in lymph node metastatic disease compared to controls. Finally, lymph node metastasis was compared to distant metastasis, and 3 microRNAs were differently expressed. miR-485 was 3 times overexpressed in lymph node metastasis compared to distant metastasis. In conclusion, circulating miR-146B was indeed associated with PTC recurrence. However, other microRNAs may identify metastatic disease and differentiate lymph node from distant metastasis. Therefore, microRNAs levels represent important circulating biomarkers to diagnose recurrence and predict prognosis of PTC patients. Thank you for your attention.